Did you know over 50 lakh Indians are successfully managing their diabetes with insulin? If you or someone you love is struggling to manage diabetes and have been advised to start insulin, you are not alone. Hello everyone. Today, we'll discuss why insulin therapy is important to manage diabetes and how starting insulin treatment can be easy and smooth. To help us, we have a diabetes expert here. Hello, Dr. SOWMYA D RAO. Thank you for joining us today. Doctor, whenever you prescribe insulin to a patient, the common question comes into a patient's mind is why insulin? Why their previous medications are no longer sufficient? And what are the added benefits of starting insulin? Could you please brief on this?
Hello everyone, my name is Dr. SOWMYA D RAO from Mangaluru Specialty Clinic. Today we will answer a few questions asked by most of the patients regarding insulin. So, insulin is a natural hormone secreted in the body to control sugars, but when it comes to diabetes, it is a deficiency of this hormone which causes increased sugars in the body. But when we prescribe insulin to patients are always in a dilemma whether to start on insulin or we can continue with oral medications. It can cause complications. What will if I get addicted? So these are some of the questions the patient will be apprehensive about. So here are a few questions which I would like to answer, which come to me from a patient as a doctor. So first question, doctor, whenever you prescribe insulin to a patient, the common question which comes to my mind is why insulin? Why previous medications are no longer efficient, and what are the added benefits of starting insulin? So, like I already said, I understand it is very easy to continue with oral medications. Carrying medicines, tablets is much more easier. You do not have the fear of having to prick yourself. All these doubts I understand, but you should also understand that insulin is a hormone which is secreted from the pancreas to bring down your blood sugar levels. When you have a decreased production of insulin, or it is not effectively sensitive and the body is not effectively sensitive, that is when your sugar levels increase, and sometimes your medications may not be sufficient. That is when we tell we have to start you on insulin. Also, when your sugars are not under control, you can have microvascular and macrovascular complications which can cause so many complications in the body. Like you can have a heart attack, you can have a stroke, you can have peripheral arterial disease and many more things like kidney disease, retinopathy and all these complications. So in order to prevent these complications which will decrease your quality of life, which will increase much more financially and other mental burden to you, it is always suggested to bring down your sugars and also to prevent all these major complications. The best remedy for all this at this point of time would be insulin, and that is why we recommend the use of insulin.
Thank you, doctor. We've understood that insulin helps to manage diabetes and prevent other complications. But still, while starting insulin, patients are having few more worries such as, how do I inject insulin? Can I manage it alone and feeling awkward to inject insulin in a public place, etc.?
Okay, now coming to, it would have been easy to convince the patient also, but then there are many more questions the patient will have, like how do I inject insulin? Can I manage it alone? What about using it in a social setting in public places? So, I understand it is not so easy to start a new thing. You are already worried about that. You have started on insulin, now how do I use it? Will I be able to manage it? Will I need help of another person? How do I carry it? In a family function in front of everybody, how do I use it? These are the common worries you will have. I understand that, but then you should also understand that is for your own benefit we have started insulin, to improve your quality of life, for better control of sugars and to prevent many other complications. So how will you use it? Now the science has developed, technology is improving. You don't really have to use the olden days technique of vial and syringe technique. You can always choose the insulin pen, which is easy to carry, comfortable to handle without any hazards. You should understand, when you learn a new skill, maybe you join a swimming class, you will always have the fear what might happen. So similarly, this initial first few pricks might be fearful, but as and when the days pass, it is as easy as you have your food or you go for a walk or whatever it is. So it will not be so cumbersome in the later days. So this is a insulin pen which you can carry wherever you go. This will have you can fix a pre-filled cartridge in it. It has a dose regulator which you can just turn. So depending on the dose of whatever your doctor has prescribed, you can set it. For example, if I tell 5 units, you can bring it to 5. Bring it to 5 by turning the knob, and once you adjust it to the required dose, you just hold it like a normal pen and just press and hold it for 6 to 10 seconds, and then you remove it. It's as simple as that. The only thing you should keep in mind is you have to regularly change the needle. So needle is ideally, I would tell, daily, maximum of 2 injections with 1 needle. Keep the pen in a dark place where there is no direct exposure to sunlight. You don't have to keep it in the freezer or in the fridge. You can keep it in a bag or in a cool dark place. So once the cartridge is empty, it is so easy to change to a new cartridge without discarding the pen. Also another few other thing is, you don't have to prick it at the same site every day. You have to keep rotating the sites. So if you can inject it on your arms, you can inject it on your abdomen, you can inject it on the thighs. So these are few of the common sites which you can choose to inject, and you keep rotating the sites. The same site you don't prick multiple times. And yeah, so since it is so easy, you don't need another person to inject. You can manage it alone. And then when using it in the public place also, see, once you start doing it, you are educating other people and creating awareness about how much important caring for your own self to maintain your health is. That way you are going to be a motivation to so many other people who are thinking twice about starting insulin. So small things, it will matter a lot.
Very aptly answered, doctor. Like any other new things, insulin initiation can be learned and managed easily. But there are some more fear factors which needs your expert opinion. People have a common perception that injecting insulin is painful. It causes hypoglycemia, weight gain. It needs to be taken lifelong, and sometimes insulin is habit making. Is there any truth in this?
Next common thing, people have a common perception that injecting insulin is painful. It causes hypoglycemia, that is low sugars. It causes weight gain. It needs to be taken lifelong, and sometimes it can be habit forming. Is there any truth in this? This is also a very important question of concern. So let's start with whether injection is painful. As you can see, this will have a very small tiny needle of 4 millimeter dimension. So you will not even realize when it has gone inside and when was it out. So, and you keep rotating the sites, you will not even know. It is not painful as an ant bite also. So no, it is not going to be very painful. It is going to be very easy to deal with. Next was hypoglycemic events. Yeah, if at all, if do not follow the orders given by your doctor, like keep your food ready, when you are using 30-70 or rapids, fast acting, short acting or intermediate acting insulins, if you do not have the food ready and you just take the insulin and then it cause a delay, it can cause hypoglycemia. You do not eat food for a long time, it can. That is common with any of the medicine, it not necessarily with insulin. So always make sure you follow the doctor's advice of when to take the insulin, how many minutes before the meal or with the meal or after the meal. However it is prescribed, please adhere to the prescription. Also carry a ID card with you all the time which will mention the details that you are a diabetic. I'm just giving you an example. This is an ID card where you are mentioning that your name, your age, that you are a diabetic, you are on insulin, your doctor's number probably, and your contact number of somebody close to you or your family. Also, it is very important to educate your family also about insulin, about diabetes and about hypoglycemic events, so that when such an event, by chance if it happens, how to deal with such episodes. Always carry hypoglycemic tablets with you, so that if there is an event of hypoglycemia, you just swallow them so that you do not have to face serious consequences of hypoglycemia. So always be prepared for episodes, but you can always prevent such episodes by sticking on to the dosages, sticking on to proper meal times and eating the right amount of balanced meals. Next thing is whether it is required to take it lifelong. Will it become a habit of taking insulin? No. See, there are so many situations when we would have to manage your sugars tightly, so insulin might have been prescribed. Gestational diabetes, that is diabetes during pregnancy, it has to be managed with insulin. Or during surgeries or during acute conditions where patient needs tight control of sugars. So this could be short-term use of insulin also. Also, if you follow a very good lifestyle, start taking care of your food, start exercising, have a very good schedule, you start yoga, you start meditation, so mentally you are relaxed, and then automatically when your body reacts well and your sugars come under control, the insulin dose can definitely be decreased and it can also be stopped. There are instances where we have stopped insulin for many patients and their sugars are under control only with oral medication. So don't be under the wrong conception that insulin is for lifelong. Once insulin started, there is no going back. There is nothing like that. Ultimately what matters is your sugars being under control, you following a very good healthy lifestyle which will help in improving your insulin sensitivity and decreasing the dose or maybe even stopping insulin and coming back to oral medicines and maybe even decreasing the dose of the tablets. So it's all in your hands. A good lifestyle, proper regular consultations with your doctor, following your medicines, having right medicines, right time is the key to managing your sugars and also to prevent many other chronic disorders. So I hope I was able to convey that insulin is not a difficult thing to manage, and when a doctor prescribes insulin, you will wholeheartedly accept it. It is for your own good. Thank you.
Thank you, Dr. SOWMYA D RAO, for sharing the facts with us. I'm glad that you have presented in a very clear and understandable way. Surely this would benefit the viewers and encourage them for a hassle-free insulin initiation to manage their diabetes better. Thank you everyone and have a good day.